Lower Blepharoplasty Near Me. Welcome back. I'm Dr. Jon Mendelsohn, Medical Director of Advanced Cosmetic Surgery and Laser Center, your eyelid rejuvenation expert. Today we're zooming in on lower blepharoplasty. Join me as we explore the options and find the best lower blepharoplasty near you. Lower blepharoplasty can work wonders in rejuvenating your gaze and refreshing your lower lids. I'll guide you through a few of the considerations for finding the perfect surgeon to enhance your lower eyelids. Find a reputable facial plastic surgeon who has performed thousands of lower eyelid blepharoplasties in their career. Over the last 20 to 25 years, the general approach to lower eyelid rejuvenation has changed significantly. One of the ways lower blepharoplasty rejuvenates the lower eyelids is by addressing what we call the fat bags under the eyelid area. It used to be that we would remove as much fat as we could during the procedure. Let me describe this in a little more detail. Take my glasses off. In our lower eyelids, we have orbital fat. Well, we have orbital fat around our globe, around our eyeball, so it allows it to glide in its socket. In our lower eyelid, there's a partition called the orbital septum. When that fat around our orbit pushes on it, it can push it out so it looks like we have a bag. There are three discrete fat pockets. Commonly, there's a lower blepharoplasty procedure, which we've described elsewhere, but briefly, this is a under 30-minute procedure performed under local anesthesia where we make a small incision on the back side of the eyelid commonly. We'll take a little retractor and a Q-tip and we'll expose these fat pockets. Back in the day, 25 years ago, we used to remove as much fat as we possibly could. Why? We're solving a problem. You have bags, we want to solve it, so we remove as much as we can. The problem is that we left patients looking cadaveric or sunken in. That is, there's now a depression, a hollow where there used to be a bag. So while we've solved a problem, it really doesn't rejuvenate the eyelids any better. In fact, you probably look sort of sick. Over the past years, we focused more on the anatomy in this region. And so let me describe this to you. The lower eyelid itself, where that fat is, we're going to call that a mountain. And if you look very carefully, we have what's called a tear trough. There's a concave area beneath that called the tear trough. So the discrepancy doesn't make it look very good. What I just said is we used to take the fat, we used to remove as much as we could all the way down to that tear trough. So we'll call the fat a mountain and the tear trough a valley. We used to take the mountain all the way down to the valley. That's not a good idea. These days, when we perform lower eyelid blepharoplasty, we'll take the fat and we'll reduce it significantly, but not all the way down to the tear trough. We don't want you looking cadaveric. You perform the surgery, it looks great. It rejuvenates the lower eyelid. Fantastic. It may be a month or 3 months or 6 months or a year down the road, however, where you start recognizing the tear trough is still a little bit lower, and we might come back and we might use injectable fillers to augment that area. So oddly enough, even though we've got a bag, we might use fillers in the tear trough area to augment that area. Sometimes we also use skin resurfacing, like the dot laser. And as you're looking at me now, I'm about 2 weeks out from my dot laser, which is why my lids are still red here. What does that do? That helps tighten the skin. It helps refresh the skin, fine lines, crepiness, wrinkles, discoloration, those sorts of things. So lower eyelid blepharoplasty should be performed by experts who understand what they're doing and what the impact is for the long-term result. With all of that being said, find a surgeon who understands and can explain your anatomy and can prescribe the best treatments for your lower eyelid region. The solution is not always surgery. If you're ready to open a new chapter in your eyelid rejuvenation journey, then hit subscribe for more eye-opening insights. This is Dr. Mendelsohn, and I'll be back with more insights in other segments.